I'm Dr. Chad Edwards, founder and medical director of Revolution Health and Wellness Clinic. Today we're going to be starting a video series on testosterone and testosterone replacement. We will get a lot of patients that come to us complaining of things like low fatigue and poor sex drive, just not feeling their best. And so they'll often wonder, should I be on testosterone replacement? Great question, and there are risks and benefits to something like testosterone replacement, and that's kind of what this initial video is going to be about. So testosterone is obviously a steroid hormone with both androgenic and anabolic qualities. Androgenic meaning that it contributes to male sex characteristics and features. Anabolic meaning that it contributes to things like muscle growth and development. So there are definitely benefits to enhancing levels, whether you do that naturally or whether you do that because you're adding testosterone as a supplement. It's really just an individual decision on is this something that you should do. So some benefits of low testosterone, some symptoms of low testosterone would be things like fatigue. You'll often get some mood instability. You'll get lack of exercise performance. You work out and you're just not seeing benefits with that. Sex drive goes down. Often erections will begin to decline. And so those would be some symptoms. And there are a list of others, but those are some symptoms that would make us think maybe your testosterone levels are a little bit low. So in our clinic, the very first thing that we're going to do is check labs and determine a lab level for your total testosterone. Very easy to do. If you don't have insurance, it's inexpensive to test that. Just a simple blood test, and that gives us the information. So we want to know where you are to start. Initially, in order to get testosterone to cover testosterone replacement therapy, you have to have an accurate and comprehensive diagnosis of testicular hypofunction. And most insurance companies will require something along the lines of 2 separate levels first thing in the morning or before 10 a.m. in the morning on separate days, and those levels generally need to be less than 300. Some labs will use a different cutoff range, but often less than 300. Some, again, will do like 250 or something like that. We at Revolution Health and Wellness Clinic believe that those levels should actually be much higher than that. We prefer optimal levels of testosterone, and some of the videos that we're going to focus on in this series are going to address what does optimal mean. So we'll be covering that more in the future. So we'll check your testosterone levels, and if you are in fact low, we would consider giving you testosterone replacement. But before we do that, you also have to consider that there are some risks. Certainly there are benefits, and those include reversing some of the symptoms that we see. And there are a whole host of health benefits as well. And again, we'll be covering more of those in future videos. But some of the risks of testosterone therapy. Testosterone is a precursor to estrogen, and there's an enzyme called aromatase that will convert testosterone to estradiol. And we measure those levels in both men and women. When we give you more testosterone, it tends to make you convert more over to estradiol. There are good, healthy, appropriate levels of estradiol. If it's too high, that's a problem. So we want to treat that, and there are ways to do that with medications, nutrition, nutritional supplements. So there are several options in ways that we can address that. So the first one is too much estrogen. Second thing that we need to consider is that testosterone can increase your red blood counts. So there's a condition called polycythemia where your body actually makes more red blood cells, and in this case it would be secondary polycythemia because the testosterone is causing that. There is some question if too much red blood cells caused by testosterone increases risk of things like blood clots. So sometimes, and some physicians in other clinics, sometimes based on levels, will recommend that we actually give blood, do therapeutic phlebotomy, where you give blood to try to get those counts down. So again, that secondary polycythemia where your red blood cell counts go up, fairly easy to treat that. We just need to screen for it. Obviously something that we do here at Revolution Health and Wellness Clinic. Another thing that testosterone can do, the way I often describe this is if you have a factory where you produce widgets and you decide to outsource the production of those widgets to another country, you don't need as big a factory. So the testicles in men are what produce most of the testosterone. If you are taking testosterone as a supplement, the body recognizes that you've got enough testosterone. It doesn't send the signal to the testicles to make more testosterone, so you can actually get some testicular atrophy, meaning that the testicles get smaller. For some men, that is a real psychological problem. Some men don't care. It's not a medical problem, but it is something that you need to be aware of, and something which we'll watch for and is treatable if that becomes a problem for you. We just need to know, and there's lots of things that we can do for that. The final thing on the bigger issues with testosterone as far as risk is that we can lower your body's ability to make testosterone on its own. Just kind of like with outsourcing of the widgets and the testicles getting smaller. If your body doesn't need to make it, then it doesn't make it. And over time, your ability to make it on your own can decline. If you're on testosterone for a fairly short period of time, may not be that big a deal to stop it and restart it. In a short period of time, I'll say 6-month range. If you're on it for a couple of years, it increases the likelihood that you're going to need testosterone replacement therapy long term. So those are some things that you need to keep in mind as far as risks for testosterone replacement. There are others that we will get into in future videos, and we'll address things like blood clots. Does testosterone cause you to develop more blood clots? We'll talk about, does testosterone cause prostate cancer? Does it, or contribute to prostate cancer? Does it cause heart attacks? And we will address all of those things in future videos. So be sure and stay tuned for those. If you're not a subscriber, be sure and hit that subscribe button. Like this video, that way you don't miss out on future content. So I look forward to sharing this other information with you. Thanks so much for watching.